Hello, everybody. My name is Cameron, and I'm your Aflac representative. Aflac is one of your options this year. And because Aflac is so different than your other insurance, it really must be explained. And that's the purpose of this video. And I'm sure you've seen the duck commercials, but they don't do a good job of explaining how these plans help you and your family. So after I go through these plans, you'll have a very clear understanding of how these plans work. So thank you for taking the time to go through this. You may still have some questions about the plans, so please feel free to call me or email me. I could also help you guide you through them based on your specific life situation. If you need help with the Aflac part of the enrollment system, please call. You should have an Aflac summary of plans. It should have been attached to the email with this video link, and I encourage you to take it out and follow along. It has all the rates and the basic information. If you don't have it, please contact me. So it's important to understand how Aflac is different than your other insurance, and it comes down to two simple problems. And if you or someone in your family that had a medical event, especially if it's something serious, there are two basic problems that affect all of us. First, they're out-of-pocket medical expenses. Second, if it's serious enough, we may not be able to work. So at that moment that our expenses have increased, our income has taken a nosedive, and that is a problem. Medical problems is the largest cause of bankruptcy in this country. So that's what Aflac helps with. That's what it does. It pays cash to you directly after an accident, illness, and maternity. Remember, that is cash paid to you, not the medical facility. Think of it as a safety net that comes into your hands at the moment that you need it the most. There's some very important things to understand how Aflac works, and again, how it's different than your other insurance. First of all, rates never increase. So once you're enrolled, you will never see an increase of rates. It doesn't matter how much you use the plans. You can also take your Aflac with you. If you ever move to another place or you retire, these plans are portable, so it's always there in your back pocket if you need it. You have worldwide 24/7 coverage. It doesn't matter where the medical event occurred. You are covered by these plans. Aflac has next day pay, meaning that if you use our online service or use the app in your phone and you set up direct deposit, then you will have the money in your bank either the next day or the day after, depending on the banks. Also, Aflac pays no matter what other insurance you have. So it doesn't matter what your other insurance covers or what it doesn't cover. Aflac simply pays you based on what it says. You have three plans that are available, and they all function differently. And again, I ask you to refer to the Aflac summary of plans. You can see all three of the plans and all the different rates. So what I'm going to do now is to go through each one of these plans very quickly so that you have an understanding of how they work. You can pick and choose one plan, two plans, or three plans, or you can choose none at all. These are completely optional. You don't have to enroll all three or one. You pick which ones you want. And again, I invite you to call me if you want a personal consultation based on where you are in your life. The first plan is the accident plan. It's an extremely generous plan. It pays you after any kind of accident whatsoever. Now, it's based on medical events. So every single medical event triggers a deposit in your bank. It's that simple after you file a claim, of course. It's based, as you can see, there's a long list of medical events. It goes on to the next page, and I don't have time to go through them all, but here is some examples. The first one is the emergency accident treatment. So it's gonna, if you go to an ER or urgent care or even a dentist because you bust a tooth, it's gonna pay you between $125 to $205, depending if there's x-rays or not, plus a specific sum, which is in the next line, between $35 to $12,500, and that sum is based on the type of injury and how bad it is. Hospitalization, I'll skip down to that. It pays a lump sum of $1,250 for the first day of hospitalization, and then it pays $250 per day for day 2 and beyond. Remember, that's a payment to you, not to the hospital. It doesn't matter where the hospital is. It's a lump sum, $1,250 day 1, and then $250 for every day thereafter, and those numbers double if it's an intensive care ward. And then there's more benefits. Again, I'll highlight the ones that, like, for example, it has accidental death life insurance built into the plan of $40,000, dismemberments all the way up to $40,000. Then the wellness benefit, the last one, everybody loves it. It's a $60 yearly reward for doing something for the wellness of your body. For example, a teeth cleaning, eye exam, physical exam, a very wide range of different types of wellness benefits. And that renews every year. So every year you'll get that $60. And that covers the first 3 months of coverage if you use the wellness benefit. The second plan is the hospital plan, and it's a simple plan. It pays a $500, $1,000, or $2,000 lump sum per hospitalization. It doesn't matter why. It's different than the accident plan in the sense that that has to be an accident. This covers accidents, illness, and maternity. Now, when you go online, you have to pick which one of these sums you want, 500, 1,000, or 2,000. It also has it also pays $100 per day while you're inside the room and $500 a day if it's an intensive care ward. And then there are other benefits that are included in the hospital plan, and they have nothing really necessarily to do with hospitalization. For example, $25 per doctor visit, lab tests, x-rays, ambulances, surgeries, and etc. The last plan is a plan that I hope everybody considers. It is a plan that's near and dear to my heart. It's the lump sum critical illness plan. It's an extremely simple plan. It pays a lump sum of $10,000, $20,000, or $30,000 following the diagnosis of one of these critical illnesses. Of course, the big ones, cancer, heart attack, strokes, these kinds of things. They're called bankrupting diseases. They cause a lot of financial disruption during a tough time. So it pays a lump sum and puts it into your hands to make things a lot easier for you and your family. Now, when you go online, you have to choose which one of these lump sums you want, and you do that by just adding on the units. And feel free to call me, and I can teach you how to do that. Some important thing about the lump sum plans. Rates never increase. If you look at the summary of plans, you can see that it's based on your age. So as you get older and you see how it goes into higher age brackets, the price always stays the same. So it doesn't matter how much you get older, it will always stay at the rate that you started. So for the rate that you have today will be your rate forever, even if you carry it on and to retirement and beyond the years. Your dependents are automatically covered for half of your lump sum. So if you added on and chose $20,000 lump sum, that means that all of your dependents up to the age of 26 are covered with 10. If you're a smoker, if you indicated in the thing that you're a smoker, then it's going to be slightly more. It includes a $3,000 coronary artery bypass. And again, this is a plan for your whole life. It's something that should be in everyone's back pocket, ready to go as you continue on into your life. So how do you enroll? When you enroll into you log in and you go to the online system, you simply elect Aflac and you elect the plan or the combination of plans that fill your needs. It's going to take you to our system. You fill out the online application. Call me for assistance. Especially some of these plans ask you if you want some writers, and that may require some explanation. I'm happy to do that. I will also, after you enroll, send you a claim filing instruction sheet that tells you exactly how to file a claim. Here is my contact information. If you need any help, feel free to reach out to me. And I hope my contact information is also on the email. It's on the bottom of the back of the summary of plans. Feel free to call and or email, and I'm more than willing to help. Thank you for your time and attention to this. I look forward to getting to know you all.